Pediatric Physical Assessment Skill. The purpose of this skill is to demonstrate how to perform a complete assessment on a pediatric patient. The recommended PPE for this skill are gloves and eye protection. The first step in this skill, as you approach the patient, is to note their appearance, their skin color, and their work of breathing. When assessing their level of consciousness, if it's a toddler, assess their activity level and interaction with the environment. If it's a school-aged child, note their eye contact, mood, and orientation to person, place, and time, as well as additional questions to evaluate their memory. Next, I would assess the patient's growth and stage of development and do a thorough assessment of the patient's skin, noting the color, moisture, and temperature. I would then perform a detailed head-to-toe assessment, assessing for deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, and swelling. Beginning with the head, I would assess the skull, assess the nose and ears for any drainage, assess the eyes for pupil size and reactivity to light, assess the mouth, ensuring the upper airway remains patent, assess the neck, checking the position of the trachea and the condition of the jugular veins, assess the chest, noting the chest wall expansion, looking for any open wounds, palpating the chest for integrity and rib stability, and assessing the patient's lower airway by auscultating the lungs bilaterally. I would then assess the heart and blood vessels, palpating a peripheral pulse, either radial or brachial, and a central pulse as necessary, and listening to heart tones. I would then assess the abdomen, looking for any open wounds, and palpating in all four quadrants, assessing for pain, rigidity, and distension. After assessing the abdomen, I would roll the patient on their side to assess their back, using assistance if necessary. I would palpate the back, looking for any open wounds, tenderness, rigidity, or masses. Next, I would assess the stability of the pelvis. I would then expose the patient and, if indicated, assess the genitalia for external lesions, wounds, rashes, or drainage on the male and female genitalia respectively. I would then assess the lower extremities, palpating an arterial pulse, so I'll palpate a pedal pulse, ask the patient if they're able to move their foot, and assessing for sensation or reflex. Assess the other extremity, palpate a pedal pulse, ask the patient if they're able to move their foot, and assess for sensation or reflex. Assess the upper extremity, palpate a radial or brachial pulse, ask the patient if they're able to move their hand, and assess for sensation or reflex. Assess the other extremity, palpate a radial or brachial pulse, ask the patient if they're able to move their hand, and assess for sensation or reflex. After I've completed my head-to-toe assessment, I would then continue with patient